Hi, my name is Sarah Wolfing. I am the registered nurse at Community Mental Health, and I just want to go over some some PPE guidelines, just some reminders. I know you guys have seen some other videos on how to put on and take off the personal protective equipment, but I was able to do a video with Patsy and Bernie this morning and get some questions for them, and also kind of feel out what equipment you guys have so we can make this a little bit more tailored to you and how this applies to you. So I guess the first thing that I want to discuss is the PPE area where you will be going into the home. Do not go into the home without putting on your protective equipment, not even inside the door. Patsy said she was going to have a station set up on the porch where all of the equipment would be that you would need to put on, but make sure all of that goes on before you step foot into the home. I want you to just remember to be mindful that pretty much everything in there, consider it to be contaminated. I know you guys are cleaning it. You're doing a very diligent job in making sure that everything stays clean and decontaminated for the residents. But just keep in mind, it's impossible to get every little thing. So for your safety, make sure you're gowned up, make sure everything is on before you step into the home. So from that, we're going to start with the first thing you always put on is going to be your gown. Patsy and Bernie said that you guys have paper gowns. I have a similar one. I think yours is white. And Patsy had said that yours tie in the front, or you put them on like a lab coat. These kind of go on in the back. I'm going to show you both just in case when they get another supply in for your gowns, that if they come the different with the other way to put them on, that you guys will know how to do that. So the first way I'm going to show you will be the way this one goes. So this one, you get your gown and you're going to put your sleeves on. Put them all the way through. And I want you to use every clasp, tie every tie that your gown has. It is very important to keep these secured. This one has a little bit of Velcro thing on it, but it's important to keep it secured so that as you're working around the house, this isn't falling out, this isn't falling down, falling forward to where you have to end up touching a contaminated, the contaminated side of it to adjust it. It's not falling open because you didn't, tie the waistband properly. You want on the gown, you want everything covered up here. You want this, I want to put a good example on here. You want that as tight as you can. You want all of the belts tied, and you want everything wrapped as tightly as you can. Not tight, we just want it secure tight as far as the tying of these. So once you have all of that done, you can move on to the next step. But before we do that, I just want to show you the other way to put this on. Also, when you're doing these from the front, if you get a size that maybe doesn't fit you, it doesn't close all the way in the front, put it on backwards. Put the front ones on backwards to make sure that you have that protection in the front of you. The behind, your behind area, your back, that area is a little less risk, has a little less risk involved when it comes to contamination, because you're usually facing the people or the things that you're coming into contact with. So if I'm going to put this on like you would, because you have the front facing ones, you're just going to put it on like a regular coat. Now this is first thing in the morning when you have a fresh gown. I'm not being too careful about what I'm touching. This gown is going to be clean. And if there's a way for you, like this one, has that Velcro up there, and then you have the tie here. So then this would go around the back, and this would get tied, and I have that whole front, even if this were to fall open a little bit, this whole front area is covered and protected. So now that we have that, we would move on. We would go from the gown then you would go to your mask. And I know you guys have the N95s. Patsy had them on. These are good for the whole day. Because you're a positive home, COVID positive home, we wouldn't recommend wearing them more than one day. You can go outside, take a break, take it off for a minute just to get a breath of fresh air, and you can put it back on. It is reusable in that sense, but after the end of a shift or something, it probably should be thrown away. Now with these, they have 2 straps. They have them for a reason. It helps with the seal. You want to use both straps. Don't be lazy. Don't think that just the top one will work because it feels like it fits well. Use both straps. So you're going to take your N95. You're going to put on, I typically, doesn't matter which one, when you're first putting it on in the morning, doesn't matter which one you're doing, but it's good to have good habits. So start with the top one. I'm just going to put this here. The top one goes up high on your head. It's going to kind of pull the mask up this way. The bottom one, just pull this little lip here because it tends to go up. The bottom one, I'm going to show you here, goes around the base of your neck. That's going to kind of pull it down this way. And you're going to want to make sure all of these little lips up here, this goes under your chin. You've got a good seal here. You're going to come up here, really push the metal down around your nose and the tops of your cheeks here. You really want to push that down and get a good seal. The better you can do this, the less your glasses are going to fog up, the better seal you're going to have. So then I want you to do a seal check, and that is just pull this, adjust it to where it feels tight, and I'm gonna check and see if I feel or hear any leakage coming from the edges here. That's gonna say that, you know, there's a place that contamination can get in. If I'm doing this and I can see all my air that I'm breathing in is coming through the filter, that's what you want. You want everything you're breathing in to come through that filter. That's what's going to protect you. So we have gown, we have our mask. Then if you have glasses, you're going to want to put your glasses on. You're going to set them over the mask, and hopefully they're not going to fog up because you've done that right. And you have your face shield. I'm not going to leave this on too long. You guys are going to have to wear it all day, but you're not going to be able to hear me if I leave it on too long. This you are going to want to put over your mask. See the strap in the back? It's going to go over that. It's going to come down here. You're going to have that right up against there. You don't want this up here, because then it's not doing anything. You just hold your head right, or somebody shorter than you that you're speaking with, you don't get the protection. You want it down over your mask, and you kind of want it pretty perpendicular there. So we have that. So then we have the gown, we have the mask, we have the face shield. Hopefully it's not getting too fogged up. And I don't know if you can hear me, so I am gonna take this off, but I'm gonna show you how to take it off. Once you've worked your shift or you're just going out for a break and you need to kind of get this off your head for a minute, don't touch the front. You don't want to touch anything that would maybe have contamination on it. So these typically we consider clean. So you're going to take your fingers into the clean straps here, and you can pull that off your head. I hope you can still hear me. And you're going to hold it by the string. You really don't want to touch the outside of this if you don't have to. You can put it down, but I want you to be very mindful of where you're putting it down, what you're putting it down on, because whatever that is will then considered to be contaminated until you can go back and clean that. These can be cleaned with alcohol wipes or any cleaning solution that you have. Disinfect that. These can be reused every day. Storing them, you may want to store them in a paper bag or a plastic bag with the staff's name on it, so they can reuse them every day. but just make sure that you're decontaminating them. You're doing something to clean this off when you're done at the end of the day. And while you're taking your PPE off, you don't want to take care of it right away. But when you're done and you're going to clean it up, and just make sure that you're not touching that outside edge. So I'm going to put this down over here. And I am going to move on to gloves. So with our gloves, your gowns don't have the sleeves that my gown does. You don't have these elastic little sleeves here. I think it might just be a little, maybe a small elastic loop or something. But when putting on your gloves at the beginning of your shift, you put the gloves on and you want them to go over your sleeves, on top, not underneath. I know a lot of people, the thought is that it goes under there to protect that, but you want that good seal. What this also does is it grabs that sleeve and holds it there. So if you're doing things and you're working, that holds that sleeve there and prevents it from kind of sliding up on you, going to, exposing skin or anything like that. So most importantly, it keeps that seal in place. But so you're going to put your gloves on. You're going to have them over your sleeves. So we have our gloves. We went gown, mask. We had the face shield, and then we have the gloves. Then you're ready to enter the building. Once you have all of that stuff on, you're completely protected. Then you can go in and do what you need to do. Bernie did ask about moisture. If the gowns are paper, they do provide a protective barrier between you and what you're doing, or your clothes and what you're doing. If they become wet, visibly soiled or wet, I mean like pretty wet. I don't mean soaking like you wring them out, but damp. Moisture has a way of wicking the bacteria through the material. So you do want to take that off and change it. If it becomes wet or visibly soiled, you do want to change these. I would say the same for the mask. I wouldn't want to compromise anything right now. So if these, for whatever reason, become damp on the outside, you would want to change these. Damp on the inside is okay. Your normal respiration is going to cause these to feel damp on the inside. They were made with that understanding that you're going to be breathing into it. So if it becomes wet on the outside, I would change it, and just don't take any chances. Take this, go outside and change it for another one. Do not take this off inside the home. You want to leave this on the entire time you're inside the home. It is okay to go out and take those breaks, like I said, but you need to be very mindful about what you're touching and what you're touching it with. And just assume that everything out here is all contaminated. So we have gown, mask, face shield, gloves. You've worked your shift. You're now going to, you're going out to go home. Don't take anything off until you get outside. Again, we're outside. We're going to start with our gloves. The only part of these gloves that is not considered contaminated is the inside at this point, the part that's actually touching my skin. So how we want to do this is you want to get your finger up underneath that inside of that glove, and you're just going to peel it so that only the inside, I don't know if you can see this, only the inside of that glove is touching my fingers. All of this is considered clean. It's the inside now that's considered dirty. So we're going to take that, we can ball it up in this hand. Same thing, this hand is clean. It was just inside the glove. This is considered dirty. We want to get your finger up under the glove and peel that off. Typically what I'll do is I'll keep, this is all considered clean now. This was the inside of the glove with my clean hand, but just take this, throw that away. When your gloves are off, make sure you're doing hand hygiene as often as you can, even with your gloves on when you're in the home. Just do some alcohol, sanitizing, the hand sanitizer. Just make sure you're doing that as often as you think about it, and hopefully you'll be thinking about it a lot more over the next couple weeks. So we have our gloves off. We've performed hand hygiene. One thing I will try to remind people of for the next couple weeks anyway, just because I might be going off topic, but for the next couple weeks, I would not wear jewelry to work. I would not wear earrings to work. This is a really bad training video that I'm doing this when I'm wearing this stuff. But you run the risk of, if you have a ring and you're wearing, or rings plural, and you're wearing your gloves, you just increase your risk of breaking that material on the gloves and exposing your hands. Earrings, not necessary to wear to work. You've got all this other stuff on. It's just one more thing to get contaminated. So I would not be wearing any jewelry to work. I'm not saying you can't. If you have wedding rings that can't come off, obviously, if you're afraid of losing them, you know, that's fine. Just be more mindful, be more aware that that is a possibility and it could happen. So we have our gloves off. The next thing that would come off would be our face shield, because in the real world, I would still have my face shield on, and I did show you how to pull that off. Only the strap is considered clean. So that would come off, and you would set that down temporarily until you can clean it. Now, to get to the face mask, you, again, want to be aware that this whole part is contaminated. You really don't want to put your hands on it. So you're going to take the strings in the back, and you're going to pull those off. And you can just let it hang here. I'm going to take the strings here and pull that off and just let that hang. Now, if this were in the middle of your shift and you needed to go back, we can reuse this. Bernie did say that he was going to try and get some brown paper bags. Maybe you guys can put your names on them for the beginning of the day or something, that this was yours to use. But keep in mind, inside is considered clean, outside is considered contaminated. So you don't want the clean part touching the contaminated part. You can take the edges, fold them in on each other, so only the clean part is touching the clean part. Hope that makes sense. We want to keep that clean part clean. And then you can take your bag, it's got your name on it. You can place it in the bag, and it's not touching anything that's contaminated. It can sit there until you need it again. When you go to take it out again, keep in mind, don't just reach your hand in there and grab that mask. Reach for the strap, pull the strap out. And again, this is different. Once you've had this mask on and it is contaminated, be very careful to put it back on using the straps. It will be easier because it's already been molded to your face. It's already got that kink in the metal there. So this will be a lot easier, and I'll just show you real quick. Just take the straps, put that on, put that over, and you've already got it kind of molded, but use the straps to shift it to where it needs to be. Make sure it's pulled tight, and then do the same thing with the bottom strap. Okay, if you can't get that bottom, like this one tends to pull up as I do that, I may have to reach under, pull this as I'm putting the strap on, and then adjust here. Make sure you're doing hand hygiene after doing that. Anytime you would potentially touch a place that's been contaminated, make sure you're doing your hand hygiene again. So I'm going to take this off again. So we have our gloves off, we have our face shield off, we have our mask off. We're going to take the gown off now. In taking the gown off, again, everything on the inside is clean, everything on the outside is contaminated. So if there is a way for you, I guess this is a little Velcro, to at least loosen up your ties. If you have to loosen them up, make sure there's a way for you to loosen them up. Perform hand hygiene, do the hand sanitizer. Now, in taking these off, again, the inside is clean. Reach in to your sleeve with your finger. It's all clean in there. Pull that up over your hand. Then you can take this sleeve, which my hand is on the clean side. I can use this to then grab my other sleeve. It's stuck on my watch. Pull my hand out, and I've got that. So my hands are good. Now I can take this, use it. I can touch this. Dirty to dirty is fine. So I can do that. Pull that off. And then I can take my one sleeve out. Make sure that you're only touching the inside as you're taking this off. If you are going to reuse this again, you're just going out for a minute, you need to cool down or whatever, you make sure that when you're folding it or you're going to hang it up, that the dirty side, the outside, is touching the outside and the inside is not. And then you can hang that up and you can come back and reuse it. Just be very mindful of what you're touching when you're putting it back on. You just want to touch the inside. Okay? So I think that was it. Just make sure that you're performing hand hygiene as often as you can. The more you do it, the better, really. Be very mindful of what you're touching, what you're touching things to that could be contaminated, what you're brushing up against. If you've been working all day in your gown and you're brushing up things in the home, just be mindful of what you're doing, and what you could potentially be doing, what you could be spreading. So I hope that helped. I hope you guys can use this and it makes a little bit more sense, especially now that we can kind of apply that to what equipment you have on hand. If anything changes, feel free to give the office a call. You guys know our number, and we can have a nurse go over any new equipment that you guys come in contact with or have to be using. We can definitely help you with that. So I hope that helped.